Difference between type 1 and type 2 diabetes. Now let's learn about the two most common types of diabetes. Normally, our immune system makes antibodies that help protect our body against infections due to viruses and bacteria. Type 1 diabetes is an autoimmune condition where the immune cells are confused and make antibodies to attack our pancreas beta cells. These antibodies can usually be detected in the blood and are checked at the time you are diagnosed. This autoimmune process decreases the beta cells' ability to make insulin until they can make none at all. Without any insulin, our body cannot use glucose for energy. Glucose will build up in the blood. Our body will instead break down fat and muscle proteins to make energy, producing toxic compounds called ketones. These will cause serious illness or death if not promptly treated. A person with type 1 diabetes must inject insulin multiple times each day to survive. The amount of insulin needed depends on the body's blood glucose level, food, and activity. Type 1 diabetes cannot be treated with pills. Researchers are studying how to prevent type 1 diabetes, but there is no cure at this time. People with type 2 diabetes do not respond well to the insulin their body produces. This is known as insulin resistance. Even with insulin in the blood, the cells do not take in as much glucose. The glucose will build up in the blood and will not be used for energy. The pancreas will make extra insulin to try to fix this. Over time, the pancreas cannot release enough insulin to keep up with the body's needs, which is called impaired insulin secretion. Problems with insulin resistance and secretion lead to having high blood glucose most of the time. Increased central body fat, not enough exercise, stress, and infections are risk factors for this condition. If you have a family member with type 2 diabetes, you are more likely to have diabetes too. Sometimes people can have type 2 diabetes for a long time before they are diagnosed. Although type 2 diabetes occurs most often in adults, it is now becoming more common among children. The most important ways to treat type 2 diabetes include regular exercise, sticking to a careful food plan consisting of a healthy diet, and losing weight if a person has extra pounds. For children with type 2 diabetes, it is important that the whole family work together to build healthy habits. Often, children with type 2 diabetes need pills and an injectable medication. Insulin may also be added to their treatment plan. Just as important, your food plan and daily exercise can help your body to use your insulin better. In the next video, we will talk about how to care for your diabetes.